Good morning everybody and welcome to our first video from Lilian Terry International. We are going to be doing a series of short videos where we work our way around the body looking at the most common pathologies, which complexes are most appropriate, and the addition of flexi-cupping where it is relevant and indicated in the body. I'd like to start off by saying that we are not diagnosing or replacing any medical advice that is given to our clients. We are merely linking confirmed pathologies with our Lilian Terry complexes that will help to bring about relief from the symptoms, balance and healing in the body. Our products are formulated by a medical doctor with specialities in pediatrics, homeopathy, and pulmonology. So I would like to start off with pathologies in the foot, the first of which is plantar fasciosis. As this becomes more acute and inflamed, it is then termed plantar fasciitis. This is where the fascia are repeatedly stressed, and the pain originates from the dense band of tissue that connects the bottom of the heel bone to the toes. A stabbing pain near the heel can be felt, and the pain is worse in the morning and upon first weight bearing after a period of rest. The causes of this condition are wearing high heels, unusually high or low arches, very tight calf muscles or Achilles tendon, and then certain types of exercise such as running or dancing. We see it a lot in obesity and also pregnancy, where there is more weight that is placed on these bands. There are also occupations where you are standing on your feet all the time, which also then causes this problem. The complexes that I would recommend would be Tramino with all its pain-killing and anti-inflammatory properties, as well as Sportz Muscles as a long-term use complex. Massage is indicated. It will help to bring lots of circulation into this area and then help with those muscle fibers. So the next condition that we're looking at is bursitis. And if we look at bursa, what are they? They are small fluid-filled sacs that will then cushion and lubricate the joints and the bones in your foot. The heel and the toes are most commonly affected, as well as the Achilles tendon. The pain is felt with pretty much any kind of movement, but especially standing on your tiptoes and if you are doing flexion of the foot. The other symptoms are heat, redness, swelling, stiffness, and extremely limited range of movement. There are many causes, some of which are overuse, injury, infection, disease, trauma, and also inflammatory disorders. I would recommend that we use Tramino and once again Sportz Muscles, and I would not indicate massage as it is going to be too painful. The next one is sprains. This is an injury to the ligaments in your foot. Your ligaments are strong bands of tissue that connect one bone to another to form a joint. And a foot sprain is caused by a sudden activity that twists or tears a ligament. So your symptoms are very bad pain, swelling, bruising, and then obviously trouble walking. I would definitely recommend Tramino as your first oil to use at least every 3 hours. And then later you can use Sportz Muscles to prevent reoccurring injuries in this area. Massage is also not indicated in the very early stages, and you can follow your RICE application for joint injuries. The next thing we're going to be looking at is poor circulation in the feet. It can be caused by peripheral artery disease, diabetes, deep vein thrombosis, and also smoking. The symptoms are cold feet, swelling, pain, aching, discoloration, tingling, and a few others. I would definitely recommend Vascu Flow as this is our circulation complex. Very, very important for diabetics because of the circulation problem. And then you can also add fluidless if swelling is then another symptom of poor circulation. Vascu Flow morning from the knee down, including the foot, and then fluidless at the end of the day. Massage is very definitely indicated, as one of the big advantages of massage is that it increases circulation and lymphatic drainage in the body. When we look at corns, we're looking at yellowish callus growths. They occur on the top of the toes, and this is because irritation of maybe footwear that is not correct fitting. I would recommend foot formula for this. It's going to help to keep that skin nice and soft and prevent that building up of that tissue. You can apply it twice daily and as required. Bunions, we are looking at a bulge of bone or tissue around the big joint of the toe, either the small toe or the big toe, and the causes are actually pronation of the foot. So it's a postural problem. It can also be the result of arthritis, where the joint is stressed over a period of time. I would recommend that you use Osto and Artho S, depending on the cause of the bunions. If further pain relief is needed, you can use Tramino, and definitely if there is going to be surgical intervention to deal with this problem, you would apply Tramino a few weeks leading up to the op, and then again after the op, applying at least every 3 hours. If you cannot apply it directly to the operative site, you can just put it on the lower leg and the foot. When we look at athlete's foot, we are looking at a fungal infection. It causes redness, peeling, itching, burning, and sometimes even blisters and sores. We are going to recommend Funnail, one of our complexes, to treat this, and it also works as a prophylactic if you are using communal areas in gyms, yoga studios, etc. Leading on from that, fungal nail infections. Once again, Funnail, it is also going to help to prevent and also treat fungal nail infections. It will also prevent it spreading from one nail to the next, and it is going to help to reestablish that nail bed so that the nail grows out nicely and looks new without any of that discoloration or ridging. Cracked heels, when the cracks or the fissures become very deep, it can be very painful to walk on. We would recommend that you apply foot formula at least once a day in the evening. When it is very severe, you can actually put the foot formula onto a cotton petal, use a piece of plaster just to stick it to your foot, sleep with it like that, and then change it every day for 3 days. And then as maintenance, you can just apply your foot formula morning and evening. Gout is the next one we're going to look at. It's a form of arthritis that causes sudden pain, redness, swelling, and stiffness. It usually affects the large joints of the big toe, but it can also flare in the foot, the ankle, and the knee. This condition is caused by too much uric acid in the body, and then you have the formation of needle-like crystals in the joints, which are excruciatingly painful. It can flare with certain problems like stress, food, and all of those things, but we're not going to look into that. We are going to look into the complex that is going to help with this, and that is Artho S. It helps with metabolic arthritis, so the production of acidity that is causing this pain, it is going to help to get rid of that. And you can apply it every 2 hours when it's very, very severe, reducing to maybe once a day as a maintenance application. With rheumatoid arthritis, this is an autoimmune systemic inflammatory disease. It affects multiple joints, especially the lining of the joints, and the symptoms usually begin with pain and swelling that affects both feet, and then as the condition progresses, the joints become affected, and this eventually causes malalignment of the joints, and this can also result in collapse of the foot arch, which then causes formation of corns and calluses. The complexes that I would recommend is definitely Activim, with it being an autoimmune condition. We need to modulate that immune system so that it is not so overactive. And then also it will help with chronic fatigue syndrome, our Activin complex. And then more specifically Artho L for those joints. And then I would also add Tramino if extra pain relief is required. The last condition that we're going to look at is bone spurs. And a heel spur is basically a calcium deposit that causes a bony protrusion on the underside of the heel bone. It may or may not be very painful, and it's especially common amongst athletes. They're often caused by stretching of the plantar fascia and repeated micro-tearing of these membranes that cover the heel bone. The complexes that I would recommend is your sports muscle, and then with the bone callus formation, Osto, and then also Tramino if there is associated pain. So those are the conditions that we're going to look at today. And then in our next video, we will be looking at conditions of the lower leg, then moving on to the upper leg with some practical videos for cupping, especially for cellulite and any major muscular problems. So you can join us then. If there's anything that I haven't covered, you are welcome to put a comment below and we can address your specific problem. Have a great day. Bye.